Welcome back, everyone. We're diving into a medical mystery today.
Oh, a mystery. I like mysteries.
This one's pretty interesting. It's about adrenal insufficiency. And get this, it's way more than just feeling tired.
More than just tired. Okay, you've got my attention. What kind of sources are we looking at today?
Well, we're going deep into the up-to-date article, Clinical Manifestations of Adrenal Insufficiency in Adults. And trust me, there's a lot to unpack here. It can impact almost every system in the body.
Wow, every system, huh? Sounds like a big deal. So where do we start?
Let's jump right into the deep end with the most extreme presentation, adrenal crisis.
Okay, adrenal crisis. Sounds serious.
It is. What makes this a medical emergency?
Well, picture this. You're hit with intense abdominal pain. Fever, too. You're thinking this has got to be a surgical emergency.
Oh, wow. That sounds scary.
It can be, but here's the twist. It turns out it's your adrenal glands sounding the alarm. That's adrenal crisis.
So it's not what it seems.
Not at all. And it can really throw doctors off track. Even rarer cases, like let's say you have a sudden shock after a back injury, that could actually be a sign of something called adrenal vein thrombosis.
Adrenal vein. What now?
Adrenal vein thrombosis. It's a blood clot in the adrenal vein. Pretty rare, but it can happen. The important thing to remember here is that the real problem in adrenal crisis isn't just about low cortisol, the stress hormone.
Right. Cortisol, we've all heard of that one.
Exactly. But there's another deficiency going on too, a deficiency in mineralocorticoids. And these guys, well, they help regulate your salt and water balance.
Ah, okay. So electrolytes and stuff.
Exactly. And when those are out of whack, your blood pressure can take a serious nosedive.
So that's why it's a true medical emergency.
Exactly. It highlights just how vital these hormones really are.
Okay, so adrenal crisis is definitely something you don't want to mess with. But what about I guess you could say the less dramatic side of things? What about chronic adrenal insufficiency? What should we be on the lookout for?
Ugh. Chronic adrenal insufficiency. Now that's a sneaky one. It's like a chameleon. Symptoms can be super subtle, easily mistaken for other things.
So it's not always clear-cut.
Not always. You might see the classic trio fatigue, weight loss, loss of appetite, the usual suspects. But it can go way beyond that.
So more than just feeling tired all the time.
Way more. Think gastrointestinal issues like nausea, diarrhea, maybe low blood pressure that makes you dizzy when you stand up. And get this, sometimes even cravings for salty foods.
So cravings, really. Now that's interesting. Is there a connection between those cravings and what's going on with the adrenal gland?
Oh, absolutely. It goes back to that mineralocorticoid deficiency we were talking about. You see, aldosterone, which is a key player in that category, it's all about regulating sodium levels in the body. So when it's low, your body's like, hey, we need more sodium, and starts sending out those salt cravings.
So the body's basically sending us a message.
Exactly. It's like a built-in alarm system.
That's pretty cool.
Yeah.
Speaking of unusual signs, you mentioned some other less obvious symptoms.
Right.
What about skin changes?
Right. One of the more striking signs is hyperpigmentation.
Hyperpigmentation. That sounds intense.
It can be. Basically, your skin starts getting darker, and not just in areas that get sun either.
Wait, really? So even places that don't see the sun?
Yep. Think scars, palms of your hands, even the inside of your mouth. It's all about increased melanin production, the pigment that gives our skin its color.
Right, melanin.
So this increase in melanin, it's triggered by elevated levels of melanocyte-stimulating hormone, or MSH for short.
MSH, got it. So that's what's behind the darkening skin.
Exactly. And here's the interesting part. With treatment, this hyperpigmentation fades. It's like proof that the body can recover if we give it the right support.
It's like the body's giving us a visual clue and then showing us it's getting better. That's amazing.
Wow.
But adrenal insufficiency, it's not just about the physical stuff, is it? What about the impact on mental health?
You're absolutely right. The mental and emotional toll of adrenal insufficiency, it's often overlooked, but it's real.
So we're not just talking about physical symptoms here.
Nope, not at all. Imagine dealing with this constant brain fog, struggling to remember things, feeling totally unmotivated. All of that can be part of the picture.
That sounds incredibly frustrating.
It can be, and it's a good reminder that our mental state, it's so connected to what's happening with our hormones. We often don't make that connection.
We really don't.
And in severe cases, adrenal insufficiency can even lead to psychosis.
Psychosis, wow, that's serious.
It is. We're talking hallucinations, delusions, distorted thinking. It's a whole other level. But the good news is, with treatment, these psychological effects, they often improve significantly.
That's good to hear. It's really amazing how much impact these tiny glands have on our overall well-being. So to recap, we've got adrenal crisis, which is acute and life-threatening. And then we've got chronic insufficiency, more of a slow burn, but still a big deal. But wait, didn't you mention there are actually different types of adrenal insufficiency? Something about primary and secondary?
You've got a great memory. You're absolutely right. There's primary and then there's secondary or tertiary adrenal insufficiency. And understanding the difference between them, well, it's crucial for accurate diagnosis and treatment.
Okay, so different types, different approaches, makes sense. Tell me more about these distinctions.
So with primary adrenal insufficiency, also known as Addison's disease, the problem is in the adrenal glands themselves, they're the ones producing the hormones.
Right, the adrenal glands, they're the hormone factories.
Exactly. But in secondary and tertiary adrenal insufficiency, the problem lies higher up. It's in the pituitary or hypothalamus, the parts of the brain that call the shots for hormone production.
Right.
So in secondary and tertiary insufficiency, the adrenal glands are actually fine. It's like they're getting faulty instructions from the brain. And that leads to less cortisol production.
Ah, so there's a communication breakdown happening.
Exactly. And this difference between primary and secondary, it matters because it can change the kind of symptoms you might experience. For example, in secondary or tertiary insufficiency, aldosterone production is usually normal.
Wait, hold on. Just remind me again. What does aldosterone do? It's been a while since our last deep dive on hormones.
No worries. Aldosterone, it's all about regulating that salt and water balance. So if
Okay.
it's secondary or tertiary insufficiency, you probably won't see the really bad dehydration or the high potassium levels. Those are more common with primary insufficiency.
Okay, that makes sense. But earlier we were talking about those salt cravings. You know how they can be a sign of adrenal insufficiency. Where do those fit into all of this?
Great question. You see, those intense salt cravings, they're more common when aldosterone is directly affected, like in primary adrenal insufficiency. But you can still have electrolyte imbalances with secondary or tertiary insufficiency too. Like you might see low sodium levels or fluid retention. That's because cortisol also plays a role in keeping that water balance in check.
Ah, I see. So both types can mess with your electrolytes, just in slightly different ways.
That's it. It can get pretty complex, I know.
Yeah.
But here's where things get really interesting. Even though cortisol is lower in both types, you actually see more hypoglycemia in secondary adrenal insufficiency. Low blood sugar.
Really? That seems kind of counterintuitive. If both types have low cortisol, why would low blood sugar be more common in one than the other?
That's a good question, and to be honest, we don't totally understand why. One theory, though, is that it might be because people with secondary insufficiency, they don't have that same level of severe dehydration and low blood pressure that you see in the primary form. So they might actually tolerate their condition for longer before going to the doctor.
So their bodies might be masking how serious it is.
Exactly. And by the time they do seek help, that chronic cortisol deficiency, it's had more time to progress, and that increases the risk of hypoglycemia.
Wow, so it's like a ticking time bomb almost. This really highlights why understanding these different types and how they present, it's crucial for getting the right diagnosis. But let's step back for a second. What actually causes these adrenal problems in the first place?
Well, the causes, they can be pretty diverse. It's often a bit of a detective story to figure out the culprit. Let's start with primary adrenal insufficiency, that Addison's disease we talked about. Most cases, they're caused by an autoimmune disorder. That's when your body's own immune system decides to attack the adrenal glands.
So it's like the body is fighting against itself.
Sadly, that's exactly what's happening. It's like friendly fire, but inside your own body. But it's not always autoimmune. You can also have infections that damage the adrenal glands, like tuberculosis, certain fungal infections, even some cancers can do it. And then there are genetic disorders that can mess with adrenal function too.
So many possibilities. No wonder it can be hard to diagnose. What about those secondary and tertiary types, the ones where the communication from the brain is disrupted?
Right, so in those cases, the adrenal glands are actually fine. They're just not getting the right messages from upstairs. And usually the problem is with the pituitary gland or the hypothalamus.
Okay, those are the parts of the brain that control hormones, right?
You got it. So for example, you might have a tumor in the pituitary gland. And that tumor could be pressing on, even damaging the cells that make ACTH. That's the hormone that tells the adrenal glands to produce cortisol.
Ah, so it starts in the brain and then messes things up downstream in the adrenal glands.
Exactly. And it's not always tumors. Head injuries, infections in the brain, even certain medications, those can all interfere with how the pituitary gland works. It's a pretty delicate system.
Wow, so we've got autoimmune attacks, infections, tumors, genetic factors. That's a pretty long list of potential culprits. Is there anything people can do to prevent adrenal insufficiency from happening in the first place?
That's the million-dollar question. Unfortunately, prevention isn't always possible. Like if it's an autoimmune issue, we don't really have a way to stop the immune system from attacking those adrenal glands. But here's the silver lining. If you do develop adrenal insufficiency, early diagnosis and the right management can make a huge difference in your quality of life.
Okay, that's good to hear. So
Yeah.
let's say someone's listening to this and they're thinking, some of this sounds familiar. Maybe they've got that persistent fatigue, weakness, or some of the other symptoms we've been talking about. What should they do?
The most important thing is talk to your doctor. Don't just brush it off as stress or being overworked. A simple blood test can measure your cortisol levels. That can give your doctor a clue about what's going on.
So a blood test is the first step. And what if it turns out to be adrenal insufficiency? What are the treatment options?
Well, the main treatment is hormone replacement therapy. If it's primary adrenal insufficiency, that usually means taking both glucocorticoids, like hydrocortisone or prednisone, to replace cortisol, and also mineralocorticoids, like fludrocortisone, to replace aldosterone.
So it's like giving your body back what it's missing.
Exactly. Now, for secondary or tertiary insufficiency, you usually just need to replace cortisol, since aldosterone production is usually okay in those cases.
Okay, so the treatment is tailored to the type of adrenal insufficiency.
Yeah.
What about lifestyle changes? Can those help manage the condition?
Absolutely. Lifestyle changes, they're a key part of the plan. One of the biggest things is managing stress. Easier said than done, I know, but stress can really make those adrenal insufficiency symptoms worse.
Right, like if your adrenal glands are already struggling, you don't want to pile on more stress.
Exactly. So finding healthy ways to cope with stress, that's essential. Whether it's exercise, meditation, spending time in nature, whatever works for you.
And how about diet? Are there specific foods that can help or things people should avoid?
A balanced diet with plenty of nutrients, that's always a good idea. But for people with adrenal insufficiency, it's super important to get enough sodium, especially if it's that primary form.
Right, because of that aldosterone deficiency.
That's it. So don't be afraid to add some salt to your food. And staying well hydrated, that's crucial too. Even a little bit of dehydration can make things worse.
So manage stress, eat a balanced diet with enough salt, and drink plenty of water. Got it. Any other lifestyle tips to keep in mind?
Oh yeah, getting enough rest and sleep, that's vital. Fatigue is a big problem with adrenal insufficiency, so quality sleep can help fight that. Regular exercise is good too, but you gotta listen to your body, don't overdo it. Pushing yourself too hard can actually backfire.
So it's about finding that balance. Staying active, but not pushing your body too far.
Makes sense. Is there anything else people with adrenal insufficiency should be aware of, especially in terms of managing their condition?
One really crucial thing is being prepared for emergencies. Remember when we talked about adrenal crisis? Well, if you have adrenal insufficiency, you need a plan in case you get sick, injured, or need surgery.
So it's like having an emergency plan, but specifically for your adrenal glands.
You got it. This might mean carrying an emergency injection kit with hydrocortisone and knowing how to use it. You might want to wear a medical alert bracelet or necklace too. Something that lets medical professionals know you have adrenal insufficiency if there's an emergency.
That's smart. It's like having that extra layer of protection just in case.
Exactly. And it's always a good idea to talk to your loved ones about your condition. Let them know how to help if something happens. Knowledge is power, right? And in this case, it could even be life-saving. I love that. Knowledge is power. This has been so helpful. I feel like I've learned so much about adrenal insufficiency today. And not just the physical stuff, but the mental and emotional side of things too.
I'm glad to hear that. It's all about understanding the bigger picture. And remember, if you're experiencing any of those symptoms we talked about, please talk to your doctor. Don't wait. Early diagnosis and proper management can really change your life.
It's amazing, right?
Yeah.
We rely on these little adrenal glands so much, and most of us don't even realize they're there.
I know. They're like these tiny powerhouses keeping everything running smoothly behind the scenes.
And what's even cooler is how the body tries to compensate when those adrenal glands aren't working like they should.
Oh, for sure. Remember those salt cravings we talked about?
Right.
Especially in primary adrenal insufficiency, that's a perfect example.
Yeah, the body's like, hey, we need more sodium. Aldosterone's not doing its job.
Exactly. It's incredible how the body has these built-in systems trying to keep things in balance.
It really is. It makes you appreciate just how complex and interconnected everything is.
Totally. And speaking of interconnectedness, the endocrine system, it's like this intricate web. Adrenal insufficiency, it rarely happens all by itself. You often see it with other endocrine disorders too.
Like what? What kind of other disorders?
Well, think thyroid disease, diabetes.
Yeah.
things like that.
So it's not just a single problem, but potentially this domino effect on other hormonal systems.
Exactly. It's all connected. So having that holistic view of health, it's so important.
Absolutely. Looking at the whole picture, seeing how all the pieces fit together,
Yeah.
that makes sense. Well, this deep dive has been a real eye-opener for me.
Me too.
I feel like I've learned so much about adrenal insufficiency, a condition that honestly I didn't know much about before.
It's one of those hidden conditions that often flies under the radar.
It does. But it can have such a big impact on people's lives.
Absolutely. But the good news is, the more we know about it, the better we can advocate for ourselves and get the right care.
Knowledge is power, right?
100%. So to everyone listening out there, if any of this has resonated with you, if you're dealing with fatigue, weakness, unexplained weight loss, any of the symptoms we've talked about, please talk to your doctor.
Don't just ignore it or brush it off.
Right. It might be adrenal insufficiency or it might be something else entirely. But the first step is getting that diagnosis.
Exactly. And remember, early diagnosis and the right treatment can make a world of difference. It can help you get your energy back, improve your mental clarity, and just feel better overall.
It can really change your life.
Well, this has been an incredible journey into the world of adrenal insufficiency.
It really has.
Thank you so much for sharing your expertise with us today.
My pleasure. It's been great talking about this with you.
And to all our listeners, thank you for joining us on this deep dive. We hope you found it helpful and informative. We'll see you next time for another deep dive into the world of health and wellness.